Hi, everybody. Good evening. It's Thursday again, so it's nice to see you here. For some reason, I cannot see your comments in the comment section. So hopefully, I could uh, see your comments here in my iPad. Hello. Okay, so I think you can hear me, everyone, and that works. Okay, so I'm seeing all of your comments, everyone. Okay, so that works. Very good. So before we start, let me introduce myself. Okay, so hello, everyone. Good evening. It's Thursday again for our Facebook Live on prioritization and delegation. So I hope all of you are doing okay and everything was okay during the Thanksgiving last week. So again, for tonight, we're gonna have questions. Practice questions for prioritization and then also delegation. Okay. Before anything else, my name is Mr. Alan Matus, and I am the nurse educator. Okay, nurse educator for almost 25 years. I have been teaching nursing students and also nursing graduates on how to pass their NCLEX examination. And also, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Now, one thing that I would like you to know also is that I'm the author of a book, which is the Simple, Fast, and Easy NCLEX Review book that you can buy at Amazon. Okay. Also, for tonight, I'll be giving you some announcements, special announcements, of course, and agenda. So, before anything else, I would like to welcome the following people, everyone. Okay. So, we have the following. So, we have Pasang Lama. Okay, so Pasang Lama, Darcy Kersus, Lady Sam. I cannot show your comments in the for some reason on the screen, but remember that this session will be aired via Facebook and also YouTube. Okay, so we have Claire Droll, we have Julie. Okay, we also have Lisa Sibayan, Rashmi Shrestha. Okay, Angeli, can you please tell me from what country you're coming from, everyone? Okay, from what country or from what state in the United States? Okay, I would like to know. So let's proceed right away to our agenda. Okay, so this is my book, everyone. That's my book that you can buy at Amazon, and also if you want to order in the Philippines, that's available now in black and white. So you can just email Matus Nursing Review academy@gmail.com to inquire how to purchase the book in the Philippines. Okay. However, you can buy the book at Amazon, also at Barnes and Noble as well. Also, aside from that, from other online sources. But number one is Amazon, of course. Okay. All right. So it's time for our first item for tonight. That would be, all right, our motivational photo of the week. So this photo is from Cherry, and she's in Florida and reviewing for the NCLEX-RN. And she sent us this photo of her review session. Okay, and I think a very nice thing about this photo is that it is facing a very nice view. Okay, you can see the trees, and of course I think that is a lake. So very nice photo that she's sending us, everyone. Okay, all right. Okay, another one. Okay, so let's see your responses in the comment section. So we have Manjinder Kaur said, I am using Simple, Fast, and Easy book. Okay, very good. And she says, very helpful. Kenny Tetang is from Houston, Texas. Okay. Lady Sam is from Irvine, California. Trisha Romy from Philippines, now in California. Okay, we have Torres Mes is from South Carolina. Alan Hill Torres. Okay, she said good evening. Okay. Now we also have other people. Pasang Lama from Nepal. Very good. We are international here, all over the world. So we have Fresel Paz from California. Okay. We have also, all right. So Cherry from Florida. Okay. Very good. So we have a lot of people joining us tonight, everyone. So thank you very much, everybody. Okay. All right. So the next one that I want to announce to everyone tonight is going to be my recent podcast interview. So I was interviewed by Christopher Kai about my endeavor as an NCLEX reviewer, about my company, and how I was able to create this amazing program and platform for students in order for them to pass their NCLEX. So Christopher Kai is the world's leading authority of story-based leadership. He is a global speaker, an executive coach, also. So he's really very famous and a very good public speaker. So he interviewed me. I'm gonna share the link on the comment section or in the comment section, so that if you wish to listen to my podcast interview, that's going to be only for 10 minutes. However, I shared with him my journey of creating when I created the program, okay, and also definitely the core purpose why I created the program in the first place, why and what is my vision about the program from Matus Nursing Review. So thank you very much, Christopher. Okay, so Christopher for interviewing me in your podcast. Okay, so thank you. So that's it, guys. So I hope that you were able to watch because I posted that in the Facebook. Okay, so we also have, so Cherry listened to the interview and she said the podcast, it was very inspiring. So thank you very much, Cherry. So for the others, I would like you to share the podcast as well. Okay, very good. All right. So another one. Okay, so again for tonight, we're gonna have your free 90-day online access NCLEX review, everyone. So the winner for last week will be announced at the end of the session tonight. Okay, so wait, everybody. Whoever wins, congratulations. Okay. Okay. Now, if you do know some people, or if you already passed your NCLEX, and this session that we have every Thursday has helped you pass your NCLEX examination, let us know. Send us a message so that we can give you a shout out, okay, in this Facebook live session that we have. And before anything else as well, I would like to request everyone, okay, this will help us a lot, or me as well, if you can share this Facebook Live with your friends. And also, if you are watching in YouTube, please subscribe so that you can be you can receive notification for the latest videos that we have for the Facebook Live. Okay. All right. Thank you very much, everybody. And now we're going to have, okay, our very first question for tonight. Okay. But before anything else, can you please give me another 20 seconds or a few seconds just to kind of like go over who came in, okay, and join us tonight. All right. So we're seeing now actually people here. So let's see. Okay, what are your messages? All right, so Cherry said, I listened to your interview. The podcast, it was very inspiring, sir. Thank you for all you do to help. Thank you very much, Cherry. Okay, and also Play also watched the podcast interview. So thank you very much also for watching my podcast. Okay, all right, so those who just, okay, so Michelle, thank you very much for sharing. Okay, all right. So without further ado, everyone, we will have the first question for tonight. We're going to be a little bit busy. So when you answer, everybody, I would like you to put the rationale, okay, the reason why you chose a particular answer. Okay, so hopefully we have good questions for tonight, everyone. So get ready, everybody. Okay, get ready, Matus Tribe. So our first question is a priority question, everyone. Okay, so let me read the question. The nurse receives the following clients after the end of shift report. Which of the following clients requires immediate nursing action? Okay. A. The 45-year-old client with head injury who has oliguria, leg edema, and highly concentrated urine. B. The 63-year-old client with leg fracture who complains that the cast feels warm after application. C. The 25-year-old client who reports slight bleeding of the stoma after sigmoid colostomy surgery. Or letter D. The 43-year-old client with atrial fibrillation who has an INR result of 2.5 during warfarin therapy. Okay? All right. In order to win the 90-day online NCLEX review, it's actually a giveaway. So just by joining here every Thursday, what we do is that we put your names and on a list, and then we go to a website, and then whichever name appears when we randomly raffle the student, the first name that will appear is going to be the winner of the contest. So what I can do also after this program is I'll share with you the screenshot of the winner tonight. You know, the screenshot, how the winner looks like. Okay. So we'll do that. So again, I'll read the question. The nurse receives the following clients after the end of shift report. Which of the following clients requires immediate nursing action? A, the 45-year-old client with head injury who has oliguria, leg edema, and highly concentrated urine. B, the 63-year-old client with leg fracture who complains that the cast feels warm after application. C, the 25-year-old client who reports slight bleeding of the stoma after sigmoid colostomy surgery. Or D, the 43-year-old client with atrial fibrillation who has an INR result of 2.5 during warfarin therapy. So most of you answered letter A. Can you please let me know why you chose letter A for this question, everyone? Okay, I would be glad to know, okay, your answer for this question, everyone. Okay, all right. So let's see the answer to this question, everybody, okay? So the answer to this question, everyone, is going to be, all right. So what happens when you have a head injury? Okay, when you have a head injury, possibly what could be damaged is your pituitary gland, right? Pituitary gland. So we'll remove that and then show you the answer, everyone. The answer is going to be letter A. All right, so letter A is the answer, everyone. And what is the rationale for this? Okay, so letter A is head injury, and some of the complications of a head injury or a brain injury or skull fracture, for example, is going to be diabetes insipidus, or you can also have syndrome of inappropriate, antidiuretic hormone release. When you say diabetes insipidus, you know that diabetes insipidus is characterized by increased urination, diluted urine, low specific gravity of urine, and also you have dehydration and fluid and electrolyte imbalance. Another complication of head injury is your SIAD, your syndrome of inappropriate anti-diuretic hormone release, which is characterized by water retention, okay? You also have edema, you also have decreased urine output and a highly concentrated urine. So in this situation, letter A is the answer because this indicates the presence of complication, okay? So what happened there is there's no damage to the kidney. The problem is there's damage to the pituitary gland, okay? And that led to syndrome of inappropriate antidiuretic hormone release. So meaning that the more ADH that you have, the you will have water retention. Am I right? So that's why A is the priority because of that complication. All right. Now, letter B, someone with a leg fracture and the cast feels warm. We all know that when the cast is warm, everyone, we all know if the cast is warm, that is an expected finding, especially if it's a plaster of Paris. Okay. Letter C, you have someone reporting slight bleeding of the stoma. We all know that after surgery or colostomy surgery, what's a possible or an expectation is going to be a slight or minimal bleeding of the stoma, after your colostomy surgery. So that's okay. All right. Now, letter D, 2.5 INR, you all know that if someone is on warfarin therapy, it's going to be, the INR is expected to be between 2 to 3. So letter D is okay, all right? And letter D is not an unstable patient. There is no complication going on there. So the answer is going to be letter A, everyone. It's unexpected. It's your syndrome of inappropriate antidiuretic hormone release. It's not your diabetes insipidus for letter A, but it's your SIAD, okay? So someone mentioned SIAD earlier, so very good. I think it was Fats who mentioned about SIAD, so congratulations, okay? So it's SIAD, which is the problem. So review your SIAD, everyone. That is another interesting condition to review for the NCLEX, okay? All right, so very good, everybody. So for those who answered letter A, you were correct. But then again, the rationale, so the rationale is very important to know also. Why is it that A is the answer? So let's go to number 2, everybody. All right. So number 2, we have another priority question. So the nurse is making rounds at the start of the shift. Which of the following clients needs to be seen first? A, the 25-year-old client who reports severe heartburn when lying down after eating. B, the 56-year-old client with heart failure who has a digoxin level of 1.9 ng per ml during therapy. Letter C, the 33-year-old client who has U waves in the EKG after having nausea and vomiting for 2 days. And D, the 46-year-old client with duodenal ulcer who complains of knowing epigastric pain after skipping lunch. Okay, so let's read the question again. Yes, Faye, you were, yes, Fats, you're correct with your answer earlier. Very good, and correct rationale as well. Okay, all right. So let's read the question again. The nurse is making rounds at the start of the shift. Which of the following clients needs to be seen first? A, the 25-year-old client who reports severe heartburn when lying down after eating. B, the 56-year-old client with heart failure who has a digoxin level of 1.9 ng per ml during therapy. Letter C, the 33-year-old client who has U waves in the EKG after having nausea and vomiting for 2 days. And D, the 46-year-old client with duodenal ulcer who complains of knowing epigastric pain after skipping lunch. Okay, so the answer is going to be, okay, most of you have given your answers, everyone, and give me your answer, your rationale, okay? What we're going to do also later on, guys, is that we'll be posting in the comment section information about the topic that we discussed tonight. So what I would like you to do is to go back to this Facebook Live because we'll be posting information about SIAD, we'll be posting information about the different disease conditions, okay? So that there will be more clarity, in your experience, okay? And also learning process here in the Facebook Live, everyone, okay? So we'll be posting additional information in the comment section. Okay, so which of the following patients, okay, will be a priority here in this question, everyone? So most of you has given your answers, everyone. Okay, all right. So I'm removing the question, everybody. I hope all of you have given your answer. So the answer to this question, everybody, is going to be letter. Very good. That would be letter C. Very good, everyone. I think most of you got the correct answer. I am so impressed, everyone. Very good. Okay, so we have a lot of you mentioned that it's hypokalemia, which is the answer, which is letter C. Yeah, letter C is the answer, everyone, because letter C, the presence of U waves in the EKG represent the presence of hypokalemia or low levels of potassium. So we're gonna put some information about hypokalemia in the comment section later on. Okay, hypokalemia is characterized by U waves and also a flat T wave, and also the presence of tall tented T waves indicate the presence of hyperkalemia, right? So when you have low potassium, especially if it's a critical level, then we really need to look at that, because very low levels of potassium can cause muscle weakness and of course cardiac arrest, right? So that's why letter C is the answer compared to the others. Now, letter A, heartburn could be a priority, of course. Yes, heartburn. We need to look at that. However, if the patient, for example, has a gastroesophageal reflux disease, so heartburn will be expected. Letter A, we still need to assess that, okay, because there's heartburn. But the question is A really the priority in this question, right? Letter B, heart failure. What is the normal digoxin level, everyone? Can you put on the comment section what's the normal digoxin level? Why B is not the answer? Okay? Because the normal digoxin level is what? 0.5 to 2 ng per ml. So letter B is expected, so that's okay. All right? Okay. Now, so letter B does not indicate the presence of digoxin toxicity. And I want you also to review the signs of digoxin toxicity. Okay, like blurring of vision, colored vision, bradycardia, nausea and vomiting, anorexia. You need to really study digoxin for the NCLEX. Okay? Now, letter D, duodenal ulcer, knowing epigastric pain after skipping lunch. Remember that if you have duodenal ulcer, okay, it's expected or it's part of the symptom that they usually have epigastric pain when the stomach is empty. Okay, and usually that happens like 2 to 3 hours or 2 to 4 hours after meals. So Unless letter D, if we add vomiting blood, then that's a different story, So A, B, and C may be important conditions, however, C comes first. The C is not an airway issue. However, it's a safety issue because why? The electrolytes are low. Okay? All right. So, very good, everyone. The answer is going to be letter C. I hope you learned something from that. We'll post some additional information in the comment section. So please go back later on and read some of the comments, scroll over because we'll be putting additional information there. Okay? In order to have better rationalization. Very good. So let's have number 3, everyone. So let's see the comment section first. We have another question. Okay, so someone said zero point 0.5 to 2, for the digoxin level. Can someone tell me what is the antidote for digoxin toxicity? Can you put that on the comment section, everyone? What's the antidote for digoxin toxicity? Okay, what's your antidote for high levels of potassium or hyperkalemia? Can you put that in the comment section? In my review program, I go over all of the antidotes. Okay, so for tonight, you will notice that we're covering some of the antidotes. Okay, what's the antidote if you're missing ADH? What's the antidote for lack of ADH in diabetes insipidus? Okay, so for digoxin toxicity, that will be your digibind, everyone. Very good. Okay, who answers first there? What about your antidote for, I asked that earlier, the antidote for another one. For high levels of potassium, you have to give your kayaksalate, your sodium polystyrene sulfonate, okay? Your antidote for diabetes insipidus or your medication is going to be your vasopressin, okay, which is an ADH. And when you're giving ADH, if you have too much ADH, you're going to have water retention, okay? So we're discussing antidotes, everyone. Just a few more. What's your antidote for iron toxicity, everyone? Iron toxicity. What's your antidote for iron toxicity? Okay, that will be your Desferal, or deferoxamine mesylate, Desferal. What's your antidote for opioids or overdose with morphine? That would be your what? Naloxone. Very good. Okay, naloxone. Okay, very good. So I have the complete list of antidotes. So maybe we could put that later on in the comment section. The different types of or complete list of antidotes. And you can find the list of antidotes in my book as well. So let's go to the next question, everyone. Very good. So you have your naloxone, which is your antidote. Very good. Okay. So cherry, naloxone. Very good. Okay. Narcan. Iron chelating therapy. Okay, so you have your Desferal, right? So we have another question, everyone. Are you ready? Okay. So your next question, everyone, will be the nurse receives an order for atropine sulfate, 0.5 milligrams IV push, stat or immediately. Which of the following clients should receive this medication order? A, the 43-year-old client with premature ventricular contractions after a myocardial infarction. B, the 58-year-old client complaining of palpitations due to ventricular tachycardia. C, the 45-year-old client who has sawtooth waves in the EKG due to atrial flutter. Or D, the 66-year-old client with a heart rate of 46 due to symptomatic bradycardia. Okay? Again, the nurse receives an order for atropine sulfate 0.5 milligrams IV push immediately. Which of the following clients should receive this medication order? A, the 43-year-old client with premature ventricular contractions after a myocardial infarction. B, the 58-year-old client complaining of palpitations due to ventricular tachycardia. C, the 45-year-old client who has sawtooth waves in the EKG due to atrial flutter. Or D, the 66-year-old client with a heart rate of 46 due to symptomatic bradycardia. Okay? All right, so it seems like most of you got the correct answer. Let's see or try to find out if you got the correct answer for tonight. One of the things that you need to learn for the NCLEX would be knowing what are the drugs of choice for the different types of arrhythmias. Okay, the different types of arrhythmias. What are the drugs being given if your patient is having bradycardia? What are the drugs being given if your patient is having tachycardia? And what are examples of anti-arrhythmic medications like your amiodarone, your lidocaine, your quinidine sulfate. So you have to know the different types of antiarrhythmic drugs. You may also have calcium blockers, beta blockers, isoproterenol, dopamine, for example, epinephrine. So be aware of all these medications, and I discuss all of these things in the online NCLEX Academy. So the answer for this question, everyone, will be okay. So that would be your letter D. Congratulations, everyone. Most of you got the correct answer. Transcutaneous pacing, if not available, atropine. Yes, that's one of the options. Your transcutaneous pacing or external pacemaker, which is temporary. Okay, so your atropine sulfate is the first line treatment for symptomatic bradycardia. Okay, or bradycardia. However, you need to be aware as well that in certain types of heart blocks, you cannot give atropine sulfate. It may not work. However, for symptomatic bradycardia, which is a heart rate less than 60, you can give your atropine sulfate. Very good. And you also need to know the side effects of your atropine. So everyone, the side effect is going to be, in general, that's going to be increased heart rate. Okay? All right, now letter A, for your premature ventricular contractions, we don't necessarily give your atropine. Usually the medications for your PVC, that would be your usual antiarrhythmic medications like your lidocaine, for example. For VTAC, well, we have to give something to slow down the heart rate in VTAC. We don't want to give atropine because in VTAC you already have an increased heart rate there. Okay? Now, for your letter C, when you have atrial flutter, we don't give also your atropine because atrial flutter is already around like 300 to 400 um, beats per minute in the atria. So atrial flutter is really very fast heartbeat. So we don't want to give atropine there. Okay. So in my online NCLEX Academy, I discuss the different types of arrhythmias and also the different drugs or the management for these types of arrhythmias. Okay. All right. Very good, everybody. So we're going to have more information about that later on. Very good. Okay. So the antidote for bradycardia is going to be your atropine sulfate, everyone. Okay, let's continue with our antidotes for tonight. Okay, what is the antidote for myasthenic crisis? Does someone know that? They asked that in the NCLEX. What's the antidote for cholinergic crisis? For myasthenic crisis, what is your antidote? Your antidote is going to be penicillin. Okay, for cholinergic crisis, your antidote is also atropine sulfate. Okay, what's your antidote for, let's say, extrapyramidal symptoms? When you have tremors because the patient receives Haldol or antipsychotic medications, that would be your benztropine mesylate or cogentine. Okay, what's your antidote for lead poisoning? For lead poisoning, we're gonna have calcium EPTA. Okay, so there's a lot of antidotes, and the most common ones, just remember them. What is your antidote for Tylenol poisoning? Okay, or acetaminophen poisoning? What's your antidote, everyone? Okay, can you tell me, everybody? The antidote for acetaminophen poisoning is going to be, okay, it's going to be your mucomist, or acetylcysteine. So thank you for your comments, everyone. I'm looking at all of them. All right, so let's go to the next one. We're going to have number 4 question, mucomist. Very good. Okay. All right, so let's have your delegation question. Okay. You will encounter these kinds of questions in the NCLEX wherein the question is all about which client can be assigned to the LPN. Okay. So a 19-year-old client, so let's say the registered nurse is working together with a licensed practical nurse to care for clients in the medical surgical unit. Which of the following clients may be assigned to the LPN? A, The 19-year-old client who requires chemotherapy due to an exacerbation of leukemia. B, the 27-year-old client who needs preoperative assessment before gallbladder surgery. C, the 45-year-old client with osteomyelitis who requires wound irrigation due to a stage 4 foot ulcer. Or letter D, the 65-year-old client with emphysema who needs a review of medications before discharge. Which patient do you think is the best to delegate or assign to the LPN? Okay? Somebody was asking if we have a Q bank. We don't have Q banks in our online academy because I know that there's thousands of Q banks out there that you can purchase also. But one of the Q banks that I recommend would be your UWorld, okay? Or you can also use your Saunders, your Q bank. But in the online academy, we have hundreds of questions and NCLEX quizzes. So every after topic that you review, there's practice questions. And that is the best way to study, everyone, to study the content. And then after that, you study the questions. We do have a final diagnostic exam that you can take before the NCLEX. But generally, you have the Q banks, we have NCLEX quizzes. Now, if you want all of the Facebook Live questions that we have or the videos, all of them can be found in the online NCLEX Academy, all of the videos here. So before you take your NCLEX, you can watch all of the videos or prioritization and delegation so that when you take your NCLEX, you are very prepared to take the NCLEX because you have prioritization and delegation mastery. Always remember that a lot of our students really come back and tell us that most of the questions that they had in the NCLEX were mostly prioritization and delegation. And that's why we really need to master this. You know, when you know your prioritization and delegation, that's a big step already, or a big preparation for the NCLEX. Okay, if you are so well versed when it comes to prioritization and delegation, everyone. Okay, so the complete set is in our online NCLEX Academy, and then also we have some videos that we post in YouTube as well. Okay. All right, so some of you are giving us some rational. A is not stable, letter B and D needs assessment. This is for RN. Some of you, let's say C. C is wound irrigation is within the scope of LPN. Okay, is that true? Okay. Then you also have C, specific assessment, focus assessment. Okay, always remember that you base your answer on the questions, right? So you have to choose the best answer the whole time, the best answer. Discharge teaching initial chemo pre-op assessment done by the RN. Okay. All right. So C within the scope of practice of the LPN. Okay. So most of you actually answered letter what? Most of you answered letter C. Okay. So let's try to find out if you got the correct answer. But you always have to base it on the what's this? You always have to base it on the question. You know, what is the best answer the whole time? So sometimes you're left with items wherein I know that this is the answer. However, there's a better answer. So always have to look at A, B, C, and D. Okay, don't be careless, everyone. Okay. All right. So the answer to this question, everybody, is going to be. Let's see if you got the correct answer, everyone, for this one. Okay. All right. The answer is going to be letter C. Congratulations, everyone. So you have your letter C. Okay. So C is the answer because you have osteomyelitis. Okay. And osteomyelitis wound irrigation is within the scope of practice of the LPN. Okay. So even though it's a stage 4 ulcer, it doesn't really mean that you cannot treat a stage 4 ulcer. We have LPNs who treat wounds. Okay. So it's going to be letter C. Why not letter A? Chemotherapy is, chemotherapy, the word letter A is not the answer. Just remember, when the RN delegates to the LPN, okay, Remember, when the RN delegates to the LPN, number one, avoid eat or take, like teaching, assessment, planning, and evaluation. All of those are for the RN. We know that. And also when delegating or assigning patients, very important as well is that the patient must be at least the most stable patient. So among these four, which one is the most stable patient? Okay. Letter A, number one, you have to remember chemotherapy. Okay, so chemotherapy is a medication that may be given IV. Okay, it has side effects. Okay, just the fact that it's a cancer patient is an unstable patient, especially with the word exacerbation. So exacerbation means that it's not a stable patient, somebody who's really very, very sick. So that's why letter A is not the answer. Okay, now your letter B. Pre-op assessment. Well, of course, assessment, especially a thorough assessment, that would be for the registered nurse, everyone. Okay? Letter D, emphysema, who needs a review of medications. Review of medications, teaching is within the scope of practice of the RN. Okay, RN. And especially it's discharge teaching also. So that's why the answer is going to be A, B. That's why A, B, and D are not the choices. The best answer is going to be letter C. So when assigning to the LPN, it's very important to ask first, is it within the scope of practice? And another question is it a stable patient or not? Okay, is it a stable patient or not? With letter C, that's the best answer. Okay, what if we change letter C to an unstable client with osteomyelitis? Then we cannot assign the LPN there because it says an unstable, okay, client with osteomyelitis. Or we cannot also delegate to the LPN any special skills that only the RN should handle, like for example EKG devices or EKG analysis or reading, for example, and interpretation. That would be for the RN. Okay. All right, so the answer is going to be letter C, everyone. So let's see some of your comments, everyone. Okay. Chemo drugs can be given by LPNs. Yes, mostly, of course. Okay, especially if it's IV administration. Okay, and you need special training, in some chemotherapy preparations, especially IV. Okay, so let's proceed now to the next one. Okay, all right. So let's put this in a question. Okay, so we have the next question, everyone. The registered nurse or RN works with the unlicensed assisted personnel and licensed practical nurse in caring for a client with amyotrophic lateral sclerosis. Which of the following tasks can be delegated to the UAP? Select all that apply. Okay, select all that apply. So let's read the question, everyone. A, weigh the client weekly. Okay, letter B, place the side rails up as ordered. Okay, C, check the wheelchair before placing the client. Okay, D, assess for urinary retention every shift. E, remind the client to drink the ordered protein nourishment. Or F, revise the care plan for daily activities. Okay, all right. Again, let's read the question. The registered nurse worked with a licensed assisted personnel and licensed practical nurse in caring for a client with amyotrophic lateral sclerosis. Which of the following tasks can be delegated to the UAP? Select all that apply. Okay? All right. Letter A, weigh the client weekly. B, place the side rails up as ordered. C, check the wheelchair before placing the client. D, assess for urinary retention every shift. E, remind the client to drink the ordered protein nourishment. And letter F, revise the care plan for daily activities. Okay? All right, put your answers, everyone. Make sure that only simple activities will be delegated to the UAP, everyone. Okay? Only simple activities, no complex activities. And make sure that it's within the scope of practice of the UAP. Simple, stable patient as well. Okay? And also simple activities as what we have said. Okay? All right. Let's proceed. Okay? Most of you, okay. All right. So we have these questions, everyone. Let me see. We have the items. So most of you, some of you answer A, B, C, and E and F. So let me see if that is correct. Musa answered that. Okay. All right. So we have different answers actually. Some people have different answers in this question. So that's interesting, everyone. Okay. You have different answers. Okay. So let's proceed, everybody. Okay. So remember the three-letter S's. Okay. The three-letter S's when delegating to the UAP. Only activities of daily living. It must be simple, stable patient, and what is the last letter S, everyone? Simple, stable patient, and it has to be within the scope of practice. Number one is the scope of practice. Okay. And then it has to be a simple activity, activities of daily living like bathing, okay, hygiene, then also like oral care, for example. Okay, so the answer for this question is going to be letter. Okay, so let's have the answer, everyone. So that would be letters A, B, C, E, and F. So who got that right, everyone? Okay, so I think we have a problem with the answer key. F is not included. Okay, so F is not included in this question. Okay, so it's not the answer. So we have a highlighted letter F, but that is not the answer, everyone. So again, the answer for this question is A, B, C, and E. That's the answer, everyone. A, B, C, and E only. Okay, very good. So let me see. The answer is going to be A, B, C, and E. So we're putting it out there just to make sure you don't get confused, everybody. Okay? All right. Weighing the client weekly, that's within the scope of practice of the UAT. Okay? Weighing the client weekly or even monthly. Okay? Place the sidewalls up as ordered. Of course, that's within the scope of practice of UAP. Letter C, check the wheelchair before placing the client. Of course, that's within the scope of practice of the UAP. Letter E, remind the client to drink the ordered protein nourishment. Of course, that's within the scope of practice. Or teaching, like reinforcement of teaching or something, but it's only reminding. Okay. And another one, letter F, is not included because revising the care plan for daily activities, that will be the RN. Okay, so even though it says only daily activities, but still the fact that it's a care plan, that has to be the RN. Letter D, assess for urinary retention every shift. That would be for the RN. Urinary retention, like inspecting the bladder, palpating the bladder, for example, looking at the urine output. But the UAP can measure the intake and the output. Okay, and if the intake and the output is low, then she can report that to the RN. However, to assess for urinary retention, that is within the scope of practice of the RN, everyone. Okay, so F is not, okay, part of the answer. So just remember that, everyone. Okay, all right. So let's proceed, everyone. Okay, so there you go. So congratulations. So someone said, Ikiagu Akudo. Thank you for being here. She said, yes, revising the care plan should be for the RN. Okay. We have another question. Can an LPN revise the care plan or not? No. Okay. Care plan revision, development, planning, creation of the care plan is for the RN. But the LPN can give suggestions to the care plan. and the LPN can implement part of the care plan. Okay, so the LPN can implement, like for example, if the care plan is about fall precaution, then for fall precaution, the LPN can implement part of the care plan for fall precautions and can also give suggestions, but not modification, not revision. Okay, all right. So that's the answer, everyone. Okay, so thank you very much, everyone. Now, before anything else, also, I would like to announce or give a shout out to our program, everyone. You know that we have the Matus Nursing Review Online NCLEX Academy, and we have the workbook, everyone, the NCLEX Success Workbook. The NCLEX Success Workbook is $94.50, and also we have the online access, which is $49 per month for a total of $143.50. That is a highly affordable NCLEX review, everyone. So if you want to review and you don't want to go bankrupt, like losing a lot of money or whatever, spending a lot of money, then our review program is very affordable. And of course, just read the testimony from the different students, the testimonials in Facebook, and make a decision. You know, at the end of the day, my goal is just really to provide you something that is of quality, everyone. Okay, and if some of you here has my workbook, can you please provide a little bit of shout out? How do you find the workbook? Do you like the workbook or not? Okay, all right. King, thank you for being here. Okay, so thank you very much, everyone, and happy holidays also, everybody. Okay, are you ready for the winner of our free 90-day online NCLEX? Okay, winner, everyone. Are you ready, everybody? Okay, so let's see who won. Okay, let's find out, everyone. Okay, and anyway, this is my workbook, everyone. Okay, this is how the workbook looks like. I'm really very happy with this workbook. It looks very, very nice, and I send bookmarks whenever we send this to the student. Don't you like it, everybody, how the workbook looks like? Okay, so it has 400 pages. Okay, very nice workbook, everyone. Okay, really simple, fast, and easy NCLEX review, even if you have graduated 10 years, 15 years, or 20 years. Okay, workbook. Very good. Thank you, Patixa, for giving a shout out to the workbook. All right. All right. So we have Cherry as well. She's saying workbook along with the online academy is really great, very helpful. Thank you very much, Cherry. And everyone, don't forget to listen to my podcast. Our winner for tonight is Rose Tolliver. Congratulations, Rose. Okay, so Rose, you won the free 90-day online NCLEX Academy access. Okay, so you have 90 days. Send us an email immediately, okay, so that we can enroll you in the program. And everyone, please send your congratulations to Rose for winning tonight's online NCLEX Academy, everyone. Okay? Okay, everybody, thank you very much for being here in our live session again. I really had a great pleasure, everybody, and for your participation. We're going to have more to come later on as well. Okay, so thank you very much. My goal always, as what I have told you, is to make the review program simple, fast, and easy. And of course, helping students, new graduates, students who graduated 10 years ago, 15 years ago, 20 years ago. And of course, if you are looking for a review program that will allow you to master your prioritization, delegation, and critical thinking, that would be our program. So thank you very much, everyone, and have a nice night. And don't forget to listen to my podcast. Thank you.